Hello, everyone. Good day. It is a pleasure having you on yet another edifying edition of the program You're in Your Health, aired on Equinoxe Radio Multimedia, another Thursday for us to discuss about health-related matters. Many of you watching or those listening have been going through extreme pain provoked by sciatic nerve pain, and you are not even aware of what this pain is all about. Tonight is the day when we will talk about this particular issue and how we can better address it. We'll be having a health expert who will be defining us on this particular issue. And to accompany me on this program is Ase Lucy Liengu, my co-host. Hello, Lucy.
Hello, Immaculate.
Good day.
Good day to you, Immaculate.
How are you?
I'm fine, thank you. And you?
I'm fine.
And good day to all our listeners and viewers.
Lucy, could you introduce who our special guest is?
Yeah, of course, our special guest today is no other person than Dr. Ahmed NFOR. He is a public health consultant. Good day to you, Doctor.
Good day, Elsie. Good day, Immaculate. It's nice being in your studio today after a very long time.
Exactly, after a very long time, as you rightly said. So, doctor, today we were looking at sciatic nerve pain. Could you tell us what is it all about and what part of the body does it affect?
Okay, sciatic nerves are a group of nerve cells radiating from the last part of the vertebral column. That means you have the vertebral bone. There are about 34 to 35, 33 to 34 vertebral bones. Towards the end of these vertebral bones, some could merge. At the merging point, they radiate some nerve cells which are like long threads from the buttocks right down to the legs. And then everybody has this. But when it undergoes a saturation, either injury or inflammation, it now results what we call sciatic nerve pains.
Now, what are the different types of sciatic nerve pains, and which of them is very common with the case or the context of Cameroon?
Before I come to these questions, I want to clarify another thing which people may confuse between sciatic nerve pain and other pains. We have rheumatoid arthritis, which is very common among people of 40 years and above. It's one of the early signs and symptoms of menopause, and it's also a symptom of andropause in men. It may sound to some people as it is sciatic nerve pains. It's not sciatic nerve pains. The sciatic nerve pains are basically grouped into two. We have the true sciatic nerve pain, which may result from either inflammation of those nerve cells or a herniated disc, because the vertebral column has discs. That's why when they do vertebral column scanning, you have disc 1, disc 2, C5, C4, they are numbered. And then when this discs, the last vertebral bones or discs are herniated, that means it can result to sciatic nerve pains. And most often, the sciatic nerve pains come as a result of inflammation rather than herniated discs. Then we have the another condition, which we'll call it like sciatic nerve type of condition, but it's not sciatic nerve, where people may feel some other pains which are like sciatic nerves, but they are neither not related to sciatic nerves. For example, we have things like muscle spasms, where sometimes you feel the muscles of your leg are all died, maybe because you have sat in one position for long, or for one thing or the other, or maybe because of calcium deficiency. You may feel as if it is sciatic nerve pain. It's not sciatic nerve pains. Sciatic nerve pain involves the sciatic nerves. And we know, as we call nerves, they are the main structures in the body that helps conduct impulses and generate what we call nervous coordination. So when these nerve cells are inflamed, now no information goes down the leg from the buttocks. That's why some people complain, my buttocks are hot, I cannot sit for long, I have pains on my legs, because there's no information circulating, because the nerves have been inflamed, and so electrical signals called impulses cannot reach the area affected.
Okay, doctor, so we are talking about sciatic nerves. What are some factors that can trigger?
That's a very good question. Sciatic nerve pain is triggered by a group of physical factors and a group of other lifestyle behavior. We have one of them, you have overweight. People who are overweight, well, statistics have shown that 80% of those who are crying from sciatic nerves are people who are overweight. When they weight, you know your weight is carried by the spinal bones, the muscles of the back and the muscles of the abdomen. They work in conjunction, and they are the muscles that holds the weight together. So when you are overweight, it can trigger sciatic nerves, possibility of having sciatic nerves. We also, I already mentioned that an injury in the spine, the spinal bones, can also lead to sciatic nerve. We have the wear and tear. Wear and tear. As we age up, tissues production in the body are reduced to less than 50%. And then tissues are dying and going. If it happens in aging people, as the tissue wear, it tears up. And when it tears up, it cannot be replaced because we're already aged. This can trigger sciatic nerve pains. And we basically have insufficient core. As I said before, the core are the muscles of the abdomen. They work in coherence with the muscles of the back to make sure your vertebral column, your weight is sustained. So if the muscles of the abdomen are weak, you could suffer from sciatic nerves because most of the time your back will be pulled downward. Then you have your job. Your job too, the job style, the kind of job you do also matters. People are overweight, especially when they sit on one spot for a very long time. When you're sitting, the whole weight of your body is on your spinal cord. It is on the sciatic nerves. So when you do sedentary jobs and you sit on one spot for a long time, it could result to sciatic nerves. And also lifting heavy loads. It is normal for you to beg somebody to help you lift up a heavy object. Maybe you want to put on your head, you want to carry it. It is very normal because as you keep lifting heavy things, it affects the sciatic nerves at the back. And then that is because it leads to poor posture. Sometimes I have also given advice to people who are overweight that if you go to a water system toilet and you have to spend some time in the toilet, make sure you sit up a bit erect. Don't slant up. You sit a bit erect because you sit erect, the weight is equilibrate, and then there will be no impact on the sciatic nerves. But when you slant yourself, it can lead to destruction and bending or inflammation of the sciatic nerves. Equally, like people I saw use working on the computer, you need to use a chair that you sit up upright, not bend. Don't bend your back, but keep bending your back. That bad posture can bring complication with the sciatic nerves. As I'm saying, from the pictures above, we can clearly just see the sciatic nerves. That blue thread is the sciatic nerve running from the buttocks right down to the legs, and the red part of it is where the pains are felt. The red part is where the pains are felt. When you look at here where the skeletal tissues are well exposed, you can see the pelvic bones. The pelvic bones are the bones that hold the buttocks. And you see the spinal, the sciatic nerve radiates from them, just directly above them, and pass through them right down to the legs. So that's why people feel pains, because the whole buttocks is made up of the pelvic bones. There are two flat bones that grow up at, they start growing at puberty, they stop growing at a certain age in male, they continue growing in female, right up to menopause in some women, for the purpose of protection of the fetus during pregnancy. So from this picture, we can see a clear illustration of the sciatic nerves. In this other picture here, we can clearly see that the sciatic nerves, which looks yellowish, clearly pass on the buttocks. That's why when you have now inflamed sciatic nerves and you sit and you are overweight, or not even overweight, you feel pains because you are directly sitting on the affected nerves. It is showing here just like a small straight line, but it is a bunch of nerves that run like threads from the buttocks right down to the legs. They are very sensitive. They have their part to play. So as we see from here, that brownish part also indicate the areas where you feel the pains. So these are some of the illustration of the sciatic nerve pain. And one of the things too, smoking a lot of cigarettes. Cigarette contains nicotine. Generally, cigarette contains nicotine. Nicotine increases or decreases the risk, decreases impulse transmission. That means those who smoke cigarette, in the long run, you discover that one part or two parts of their fingers or their lips are no more sensitive to things because of the nicotine in cigarette. So those who smoke can also suffer from sciatic nerve pain because of the nicotine impact on the body. And then we have physical activities. Those who are not physically active, they can develop sciatic nerves. The caution we are giving people today, if you do a sedentary job that you have to sit for a very long time, you drive car from long distances, make sure that at intervals of about 30 minutes, 1 hour, always try to get up from your chair, make a small stroll, take some fresh air, come back and sit on your chair. This will be better for you.
Okay, doctor. Before we further ahead, we'll communicate the number for those who love to contribute in the program. We have 670-547049. 670-547049, and another number we have 656-622222. I repeat, 656 2222 at the end. That's the number you can join us on today's edition of the program. And of course, doctor, we continue with our questions normally. So what symptoms are we supposed to watch out for?
Okay, actually, those suffering from sciatic nerves have these peculiar symptoms. You have burning pains. A pain, you feel a pain in your legs as if fire was roasting your legs. It could come once in a while or more often in some people. Then you have electric shock pains. Sometimes you feel as if you have an electric shock in the tissues or in the areas affected. Then you have the tinkling and pin needles. You feel as if somebody is choking you with small needles and the areas affected. As if small needles are piercing your body. These are some peculiar symptoms too. You have numbness. Unlike the numbness of the fingers, which may come along with muscle cramps, which may result from calcium deficiency, a numbness caused by sciatic nerve pains are generally around the legs. Sometimes you don't feel your leg anymore. You touch the areas affected, it seems as if the cells are all gone. They're dead. This is a symptom of it. Then you have muscle weakness. Sometimes people suffering from sciatic nerves, majority of people, they find it unable to jerk their leg up because they don't feel their leg. The muscles are weak. They cannot jerk the leg up. And then you have bowel, inconsistent bowel. That means sometimes urine comes uncontrollable. You feel as you urinate, before you go to the toilet, urine is already flowing. There are many other things that could cause this, but sciatic nerves too is one of the risk factors or one of the things that could result to this bowel disorder. Then we have also one of the early symptoms that affect most people with sciatic nerves is we have a choking sensation in the bones. You feel as if something is eating you right in the bones. Why? Because the sciatic nerves are all attached. They are closely attached to the pelvic bones and the bones of the limbs. So sometimes you feel as if something is eating your bones right inside. But not like that type of rheumatism. But you really feel this going right down your legs. Sometimes it may go to your toes and then behind your feet, you feel this.
We have a call on the line, so we could get back to you, doctor. Hello?
Thank you.
Hello?
Yes, sir. Your name, where you're calling from, and your question.
Yes, I am calling from Ebolova, Zimbabwe, Nelson Tasha.
Okay, Nelson.
Yes. So I wish to request something from the doctor, please.
Yes.
I constantly have some pain around, I don't know, at my spinal cord that leads from my neck and affect my neck. When I shake my head like this, I'm hearing the way it's making you inside. So from time to time. So I don't know whether it is gastric or what is really causing, or it is nerve. I don't really know. So I don't know whether doctor can help me and explain to me the cause. Because at times it really disturbs me. I'm a teacher, but sometimes it really hinders me from really performing my work.
Okay, thank you. We're answering that question. You got a question, doctor?
Yeah, I think if I'm not mistaken, he's saying he's always having pains around the neck, right down to the back.
Exactly.
Yeah, I think this is something through my consultation and meeting up with patients. I've seen a lot of these cases where people feel pain. Sometimes it's difficult for them to turn their neck around, and sometimes the pains are right at the back. This is not sciatic nerves. This is nerve pain, but it's not sciatic nerves. And most of them are caused by inflammations. Such a person has to reduce a lot of fat in food and then do a lot of physical exercise and then take a lot of anti-inflammatories. When I'll be coming to give some remedies for...
Doctor, we have another call on the line. We'll get back to that. Hello?
Good afternoon, madam.
Good afternoon, sir.
Yes, thank you. I'm watching your program live. My name is Divine. I'm calling from Yaoundé.
Okay, sir. Your question.
I have a sharp pain on my right hip joint, the kind of pain that doctor is describing. Sometimes I feel it's like sending me shock waves down my right leg.
Okay.
And I feel the leg sometimes is like numb. Movement to me is really restricted, and the pain gets acute as I struggle to move.
Okay.
It has been consistent for quite a while. I was wondering if a doctor could... maybe I could get in touch with doctor, because I really need a solution to this problem. it's impossible for me to move even a small distance. I sweat profusely and I feel the pain increase as I struggle to move on.
Okay. We'll be answering that
Yeah,
question
so
soon.
I'm wondering if doctor could shed some light and if you could be modest enough to maybe put me in contact with doctor if he could really handle this issue. I was in the hospital, I've been to places, I've done the x-ray, I've done a lot of ultrasound and stuff, because when he talked about the bowels or maybe affecting your urine, I feel this sometimes my urine is inconsistent, and so exactly what he's saying is what I'm feeling.
Okay, at the end of the program, you can call this number back and we'll try to give you the doctor's number.
That would be very kind of you, madam. I'll do just that. Thank
Immediately
you.
after the end of the program. Okay, sir.
No problem.
Okay.
Okay, doctor.
Yeah,
Back to you.
I think the second caller, his problem is suffering already from sciatic nerves.
Exactly,
From
because
all
just what you
indications,
explained.
just exactly what I explained is exactly how he's feeling. So it's a sciatic nerves. I would like him to keep following the program. Towards the end, we'll give some natural therapies and some other methods on which we can make subside the sciatic nerve pains.
We still have another caller. Hello. Good afternoon. Your name, where are you calling from, and your question?
Lost
We
it.
lost that caller. Just go ahead. Now, doctor, how common is this health complication in Cameroon? Like, I've noticed a lot of people are calling. And now I also want to know what age group is mostly affected by this condition.
Okay, as I earlier said, the first question is how common is it in Cameroon? Sciatic nerve pains are not they are not health complications that we can actually evaluate because they don't stay long. Normally, they don't have to stay long.
Okay.
Sciatic nerve pains may go for 2 weeks, for 3 weeks maximum, and it's gone. But in most people, it persists because what must have caused the sciatic nerves is being repeated. It's supposed to go away. Yeah, because since we don't know the risk factor, they keep going back to the risk factor.
Seems as if we have another call on the line. Hello.
Hello.
Yes, hello, sir. Good afternoon. What's your name and where are you calling from and your question?
My name is Ganga Roja. I'm calling from Loom.
Okay. Well, we lost that caller. Okay. We hope that Ganga Rujo will get back to us.
So
yes.
I was answering you. You say which age group are mostly affected. Most people suffering from sciatic nerve pains are people from 20 years to 50 years.
Okay.
You know, as we grow up, as we put on weight, that's where most of these complications come in. As we involve ourselves in labor, hard labor, and things like that, then it start having an influence on the sciatic nerves. But younger babies do not have any impact because they have all the time to rest. The spinal cord is not as active as in aging people.
We have another call on the line. I hope we have time. Hello.
Yes, hello.
Good afternoon, sir.
Yes, afternoon.
Yes, your name, where you're calling from, and your question. Please be swift.
I'm Simon. I'm calling at Idea.
Okay, dear. Okay.
Yes. So I usually suffer from waist pain, so I don't know what is actually wrong with my waist pain.
Just the waist?
Yes.
Okay.
Okay, to swiftly answer that caller's question, waist pain on its own cannot be sciatic nerve pain. Waist pain is one of the symptoms of aging and menopause and andropause in women and men respectively. But when the pains radiate to the legs, that's what we can talk about it. Most waist pain can also come in people who are overweight. It's accumulation of an acid called uric acid, which is a waste product of metabolism.
Now, we'll go straight away due to time constraints. We'll go straight away to diagnosis. How is this condition diagnosed?
Mostly, there are a group of specialists called chiropractitioners. What they are specialized in, they have well studied the skeletal system. They know the positions of the various bones because the skeletal system has 206 bones.
We'll come back to the diagnosis. You know, we are here for our televiewers and listeners. Hello,
Okay.
Good afternoon.
Good afternoon, madam.
Good afternoon. And your name, where you're calling from, and your question. Please be swift.
Okay, I'm Mr. Ande. I'm calling from Daido, Douala.
Okay. Go ahead. Hello, Mr. Ande. Can you go ahead? We'll just continue the diagnosis since it's not connected.
Okay, as I was saying, the chiropractitioners are people who are specialized in they have studied the skeletal tissues, they have studied the bones, they know the structure, the human anatomy and physiology of the various bones. And when you fall victim of sciatic nerves, to diagnose, to know exactly what must have been the cause, they do physical, like kind of massage to trace the bones, whether they're in position, whether one of the bones is dislocated, whether the tissues are in position. When they do this, they can also do bone fixing, which means if it means that it's one of the discs in the spinal cord, which must have maybe displaced a bit from its position, they can fix it back. If it is also in the limb, they can do this carefully. They are trained on it. They can do this. I doubt whether we may have few of them in Cameroon.
Okay, doctor. So, what are the natural remedies to this?
Actually, when we talk about sciatic nerves, we don't really talk about treatment. There is a confusion even right from the level of the hospital where people mostly go on painkillers. While painkillers like ibuprofen, over-the-counter medications. But for natural therapies, we can only prescribe things that can reduce inflammation and then gradually subside the pains. This can be anti-inflammatories that people can take. We have a lot of we have anti-inflammatory teas that are packed in the market that people can drink. Though to have a good quality one, it may be very difficult. But we know our famous fever grass is an anti-inflammatory grass with turmeric. These are things, if people are aging, could introduce turmeric, fever grass, and cloves. They call it in pidgin stick match. It's used like spices in achu and other like. If these three are combined, dried, and then used as therapies in tea, it will go a long way to discuss some of these inflammations. And then another thing we could do is cool and hot massage, which means the areas which have these problems, they can massage it with cool water or with hot water at least 3 times a week. This is another natural therapy.
Thank you so much, Dr. Ahmed, for public health consultant. It was a pleasure having you on this program today.
It's my pleasure.
Lucy, it's really a pleasure being with you.
Always a pleasure.
And thank you to all our millions of televiewers and listeners on Equinoxe Television and, of course, Equinoxe Radio Multimedia. It is a pleasure being with you. And that's what put an end to today's special edition of the program, You're in Health. For presentation, I am Immaculate Fogua. I received technical assistance from Raphael Dipanda and Bertrand Bonzini. Have a wonderful day in the company of more interesting programs, of course, on Equinoxe Radio and Television.